So for the assessment and appraisal, next next services, guidance service, assessment and appraisal. So assessment comprises instruments and procedures to gather data for student appraisal. Appraisal encompasses process for measurement using a range of student attributes, abilities, interests, and for making professional judgment based on the results. So it can be for individual inventory. It helps students discover, assess, and understand their potentials, values, interests, abilities, aptitudes, and their personalities. It uses data to make informed judgment. It it can be basis for deciding on and planning program and activities for information during counseling sessions. Okay, so this can be the test given by the testing center. They can give personality test, or mental ability test, or academic test, diagnostic test. So these are the assessment and appraisal. Okay, our work values inventories, our interest inventories. So we have a lot of it. And um, so in UNC, we have testing center and guidance center. We have a registered psychometrician and RGC who is designing the testing program, administering, doing the administration of the test, scoring of the test, norming of the test, and interpretation of test results. So you can understand more of this when you do your psych assessment. Okay, here is the sample testing program. If you're done with your psych assessment, you were asked to make a testing program for elementary, high school, and college. Okay, so here is the example of the sample testing program. Okay, what are the types of tests that you can give to the students? It can be intelligence tests, special aptitude, scholastic, interest inventories, personality tests, non-standardized tests like career assessment test, and academic achievement test. Okay. So LSAT, I Myers-Briggs, or 16 PF. Okay, so we have different types of tests that you can encounter in our testing center. Okay, so next guidance services is consultation. Okay, expert knowledgeable and skillful on how to respond to needs and behaviors sought by parents, administrators for guidelines on how to deal with people, act as advisor or enhancer, helping in the object of consultation, consulting clients. So we have regular consultation with the dean, especially with his conferencing about students, problem with students, or concern with students, or consultation with parents. So we also do that. Our consultation with teachers. So I sometimes talk with teachers about the students. Yeah. Okay, so what are the stages or steps in the consultation process? First, establish a consulting relationship, and then clarify the problem situation, determine desired outcome, develop ideas and strategies, develop a plan, specify a plan, and confirm the consulting relationship. So, uh, during the ECQ, I usually have consultation with the dean, especially with students who are having their academic problem, who have, um, what do you call that, low grades, or failing grades, or they are being dropped. So I do consultation with the dean about this problem, we clarify the problem, and we we talk about the solutions for this or the plan for the concern. Okay, so what are the qualities of a consultant? So the consultant is aware of the psychological, sociological, educational factors that may underlie certain maladaptive patterns of behavior. So, and then expert in a variety of areas, knowledgeable of the resources needed, and ability to make sound judgment to make appropriate decision, dedicated, conscientious, and industrious enough to continually update himself or herself, exudes confidence, ease in dealing with people, and equanimity, interested in helping and concerned about welfare, articulate and systematic, able to present strategies and their theoretical frameworks, intelligent and creative, able to flex and shift according to adjustment needed by the client of the consult. So what are the special skills required? Recognizing and understanding differing environments, problem-solving skills, facilitating skills, evaluating skills, counseling skills like listening, observing, paraphrasing, asking questions, explaining, feedback giving, other skills, coordination, mediating, planning, educating, motivating. Okay. Um, Sometimes she also deal with difficult parents. Um, we have consultation with parents. Okay, so you need special skills for this. Another type of guidance services is prevention and wellness. What is prevention? Keep something from happening or arising, such a disorder. Okay. Um, Primary, secondary, tertiary. So what are the primary for people not presently afflicted of any disorder? Secondary are people who are experiencing early onset of disorder. Tertiary are for people already afflicted by the disorder. Okay, so we have different groups. So content area, it can be coping skills, self-esteem, values, basic life skills for handling peer pressures, positive attitudes and behavior about crisis event, thoughts, feelings, and behavior reactivated by crisis, early pregnancy prevention, people involved, support groups, parents, older peers as role models or peers. Okay, you can give prevention and wellness to students. What are the prevention method? Prevention method, it can be subtle education, group counseling, individual counseling, training program, group classroom guidance, consultation, career guidance, group discussion, and so on and so forth. Okay. So, what are the different types of prevention and wellness services that you can give to your students? So, wellness is promote lifestyle change for healthy living by Villiard 2007. It can be stress management, understanding stress, self-awareness, stress prevention, and management. So, um, I usually give mindfulness seminars to students. So mindfulness is a kind of CBT, cognitive behavioral technique that you can share to your students. So we teach them mindfulness. It can also be recreation and leisure activities. The experience growth groups, travel, ballroom, aerobics, playtime, basketball, bowling, badminton, swimming, little parties. We also do art activity. It can also be quieting activities like massage, spa, centering, prayer, meditation, yoga, solitary walking, retreat zen, autogenic suggestion, aromatherapy, soaking in bathtub or pool hydrotherapy. So we also do quieting activities like shangchen, also mindfulness meditation.